Today we are going to look at the immunization and their adverse effects. Adverse effects. So to begin with, we will be asking some questions. So first question is, what are the adverse effects of the oral polio vaccine? The second question is, what is the adverse effect of the inactivated influenza? So in this video, we'll find out the answer to these questions as well as learn in detail. To begin with, we are going to talk about the BCG. So the BCG is the common reactions. It includes local pain as well as the swelling. And what are some rare or serious complications? It includes the suppurative lymphadenitis. Then it can also result in the BCG osteitis as well as the disseminated BCG infection. Disseminated BCG infection. Then we look at the Hep B. So Hep B, there can be a local reaction as well as there can be fever as well. And the rare complication is anaphylaxis. Then we move on to the inactivated influenza. So in terms of the inactivated influenza, so in such case, there can be the local reaction and there is the GB syndrome, GBS. That is nothing but the Guillain-Barré syndrome. And there can also be the ocular respiratory syndrome. Ocular respiratory syndrome. And there is also the anaphylaxis that can occur. Then we move on to the JE vaccine. So what is the JE vaccine? JE vaccine is nothing but the Japanese encephalitis vaccine. So this can lead to the local reaction and there can be a low fever. There can be myalgia as well. So this is all in place of the Japanese encephalitis. And what are some rare complications? The Japanese encephalitis can lead to the neurological events. Neurological events. And what are the examples? Like the encephalitis. Encephalitis. Then we also have the measles. Measles or the MMR. So the measles or the MMR. So what is the role of this measles and MMR? It can lead to the LR, that is the local reactions, can cause a fever, can cause the malaise and the irritability. So what are the rare complications? It can lead to the febrile seizures. This is in case of the measles and MMR. So the febrile seizures. Next, there is also the arthralgias which are present and the thrombocytopenia. Next, we will be looking at the yellow fever. The yellow fever. So what is this yellow fever? In the yellow fever, it can lead to headache. There is headache. Next, there can be flu. The flu associated symptoms such as and we look at the vaccine associated viscerotropic disease. Then we look at the oral polio. In case of the oral polio, it mainly doesn't have any adverse effects, but some rare it's associated with the paralytic poliomyelitis. Then we look at the DPT, diphtheria, pertussis, and tetanus. So the DPT, it includes the local reaction, and there is also the fever which can be seen. So what are the rare side effects of the DPT? So the rare side effects, it includes, there is the neurological events which can occur. Then there is such as the encephalitis. Next, there is also the seizures. There can be seizures. Next comes the HHE. What is the HHE? HHE is nothing but the hypertonic hyperresponsive episodes. Hypertonic hyperresponsive episode. After this, there is also the anaphylaxis and the persistent inconsolable screaming. So this was about the vaccines and their adverse effects. So now we'll be answering our questions. So the first question we asked was about the polio vaccine. So what are the effects of the polio vaccine? So the common reaction is that it doesn't have any adverse effects, but a very rare complication would be by the paralytic poliomyelitis. The next question we asked was the inactivated influenza. The inactivated influenza, mainly it can lead to the local reaction. And then we move on to the some minor adverse effects. This includes the GBS, that is the Guillain-Barré syndrome. Guillain-Barré syndrome. Then there is also the oculo-respiratory syndrome, and it can also lead to the anaphylaxis.